Hi, I'm Dr. Cara Christ. Globally and nationally, cases of COVID-19 have increased over the last several weeks, and now that trend is occurring in Arizona too. While our state is not currently experiencing a surge to the degree other locations are, over the past few weeks we have seen a shift of COVID-19 spread in the wrong direction. Our epidemiologists at ADHS continue to monitor the trends in Arizona's data and make recommendations for limiting the spread of COVID-19. And we remain in active communication with our public health partners at the local and federal levels and with our hospital and healthcare providers. Over the past few weeks, the statewide percent positivity, which gives us information about community spread, has gradually increased from 3.9% just a few weeks ago to 6.3% last week. This is an early indicator of increased COVID-19 spread throughout Arizona communities. 4 weeks ago, on the week of September 20th, just over 3,700 COVID-19 cases were reported in Arizona. Last week, nearly 6,000 cases were reported. This is a 57% increase. We have seen an increase in cases, with a total of 240,122 cases reported to public health. This has resulted in an increase in the COVID-19 rates in many of our counties. While the statewide metrics still meet the benchmarks for the moderate category of COVID-19 spread for businesses and school opening, we are seeing the rates and percent positivity increase in many counties across all regions of the state. The main driver of transmission, both in Arizona and nationally, appears to be small household gatherings where people feel safe because they are around family and friends and aren't wearing masks or staying physically distanced. Our hospitals currently report capacity in their inpatient and intensive care unit beds and ample availability of ventilators. And our COVID-like illness data shows inpatient admissions and emergency room visits due to COVID-19 are remaining low. With the data showing COVID-19 still circulating in our communities, Arizonans need to remain vigilant. Thanks to the sacrifice and responsible behavior of our citizens and businesses, Arizona is in a much different place than when cases started rising in June and July. Most of Arizona is currently covered by a local or county mask mandate, including Maricopa and Pima counties. We know that masks are one of the most effective methods for preventing COVID-19 transmission, and we urge all Arizonans to appropriately wear a mask whether or not they live in an area with a mandate. Arizona has implemented strict mitigation strategies along with an enforcement and compliance program to ensure high-risk businesses comply with the mitigation strategies. ADHS, along with our local and state partners, continue to investigate complaints and ensure compliance. Arizona has broad access to testing, fast turnaround for results, and enhanced contact tracing through the state and county public health departments. Our major laboratories are currently reporting less than a 24-hour turnaround time, and there are over 500 locations where Arizonans can get tested. Here at ADHS, we remain on high alert. Our Health Emergency Operations Center continues operating around the clock. We are working closely with hospital providers to monitor capacity and ensure that all Arizonans have access to care. We are working with our local and federal partners on developing plans to rapidly distribute COVID-19 vaccine to high-priority groups once it becomes available. And ADHS and our local health departments continue to follow up with cases and their contacts to prevent further transmission of COVID-19. The increased cases and percent positivity show that COVID-19 is still actively circulating in our communities. Arizonans need to remain vigilant. This highlights the need for Arizonans to continue taking the important prevention steps they have been following over the past few months. Wear a mask in public, stay physically distanced from people who are not in your household, wash your hands frequently, avoid large gatherings, and stay home if you are sick. And please, get your influenza shot. This is an important way to protect vulnerable Arizonans and ensure adequate hospital capacity during this time. I want to thank all Arizonans for doing an incredible job at implementing the prevention measures. I know this isn't easy, and it's really been a difficult few months, but the data show that masks and physical distancing work. There is still more to do, and we can't let our guard down. To find out more about COVID-19, including recent data and additional prevention strategies, visit azhealth.gov/COVID-19. Thank you.